you know, what do you put on it? Or if the doctor comes and says, hey, we're gonna need droplet precautions on this person. What does droplet mean versus airborne? And what does that mean versus contact? And if it's a contact precaution, what does that mean? What am I putting on? So we made, there's a lot of stuff. So I made a little booklet for you guys. This is a cheat sheet. You guys can all have one of these of standard precautions. So when do we use standard precautions? On every patient. Yeah. And that includes hand hygiene, washing your hands, or at least do you guys have the
Sanitizer.
Sanitizer going in? At least that, in and out of the room, and after every time you touch the patient. You can go ahead and pass these out, Matt. They're in here. Just take them across the room. So anytime you have body fluid, not necessarily anything that's, you know, you're not suspecting MRSA or anything like that, just body fluids, make sure you're covered. Gown and gloves if you need. So cleaning your equipment, like stethoscopes between each patient would be great. I don't know how if you guys use those or not, if that's only the physicians. But just in general, keeping biohazard where it's supposed to be, just being general clean. So contact precautions, you'll see here, well, when do we use contact precautions? That is this orange one. This is what Roger has, and you'll see this in the facility if we go. So orange is wound infections, things like scabies, pressure ulcers. These are all examples of contact precautions. Just general rashes, ostomy tubes, C. diff. If they're having diarrhea, just presume that might be C. diff. MRSA and VRE. So what do you do with a contact precaution? What does that mean? What do I have to put on? Well, it's the gloves, the gown, this yellow gown. Can you hold up one of those gowns over there? You don't have to put booties on. I mean, you can do that if you want, but really it's just the gown and gloves at this point, keeping yourself covered. And then you're gonna need to clean the room a little differently after, make sure you have a good cleaning. Okay, so the next one is droplet precautions. This is the green.
So is it saying what we're cleaning it with, or we just able to use our blue Clorox?
C. diff you need Clorox with, the rest of the outside wipes are fine with any other contact
Just want to make
precautions.
sure if that's
As far as I know,
what
Beth, correct me if I
That's
got
right.
that wrong.
And then do you guys use property track if you need to terminal clean a room, like if it's?
I've never
never
heard
had-
of terminal cleaning a room ever.
Okay. So
And
it's
hopefully they need to, probably.
But we can.
And usually it's a phone call, because I don't have time sometimes to sit down and actually do a property track.
Which is okay too. We just want to
I'll just make a phone call.
Yeah. Who do you usually call in that kind of a situation?
Brian.
Brian?
Um,
Roger. Are you
Roger,
Roger?
yes.
Okay,
Sorry. my
that's
brain-
fine. I was like,
Just
Yeah,
fine.
he's
He's good.
good.
He's good with
Whoever
phone calls
answers
or
the phone. At that phone number.
yes. Yeah, so the big difference between contact precautions or, you know, C. diff and everything else is just the bleach for cleaning services.
Okay, so next are droplet precautions. So, I'm sorry, yes.
So we're supposed to wear the yellow gown anytime somebody has diarrhea?
No, not necessarily.
Okay.
That's just if it's a known C. diff. If they said, I was in the hospital at
Okay.
St. Al's and I had this thing and I thought it was gone, but now I'm having tons of diarrhea again, I'd be really suspicious that, or they're on antibiotics. A lot of antibiotic treatment is what
We have a lot of people
precipitates.
with confirmed C. diff that we treat.
Yeah,
and
it is a
it's-
pretty common
We
one.
don't use
and
that
it
down,
does
we just
spread.
blood, and we're not wiping stuff down afterwards.
So you do want to be careful. If it's a known C. diff, I would put that gown on because you can take that home on your clothes with you. You know, same thing with MRSA and some of these other contact ones. That's why they want you to wear that gown. You can take that home. It can live on you for a while, and then you can bring it to your babies and your family and your stuff, and you may never know.
So, are you saying that you have C. diff patients coming into the clinic that are symptomatic and having like active diarrhea?
All the time, every day.
Okay. So that's I'm glad you brought that up. So that's a perfect time to be using these contact precautions.
Because we usually got them constantly, we cannot get rid of it.
So the other problem with that is if you have it on you or you get it on you and you go to another room, it's now a nosocomial infection, right? It's something we gave them when they came to the hospital. They didn't have it, but now
But the
they're going
problem
home with
being is
something
that,
that they
they're
should
coming
store
in,
home.
they're sitting in the waiting room, they're
using the bathroom.
they're using
Right,
the
that's what I'm more
bathroom,
concerned
they're
about. Waiting
in the
room.
rooms,
Yeah.
but you're not touching the diarrhea. Granted, I know it could be on their hands.
Yeah, and that's
And whatnot, which is a problem, which is why I educate big on washing your hands, but still, so they're
Yeah, and if
everywhere.
that happens, so I would recommend using you know, so use your contact caution with, it's easy, we'll show you, it's really easy to get, especially just gown and gloves, you can on and off pretty quick, you get pretty used to that at the hospital. But that's the best way to keep it from spreading. If they do use that front bathroom or use a bathroom,
They use the
and you
bathroom,
know,
they're sitting in the front.
I
lobby,
would
is
use
there-
the bleach wipes. Do you have them in the, in?
Yeah, we have them in each room, but like
Yeah,
I said,
so I would just make sure
they
you
don't,
write them.
the front doesn't necessarily know that they have C. diff. That's the whole thing, and they've been sitting in the lobby,
Mhm.
But
reading
they're not-
magazines, touching
right.
things.
Yeah, and
And
that's,
so-
you know, and that's one of those cases where we're just gonna do the best we can. I really think this registration, you know, they're gonna do a good job of screening what they can and, but as soon as it's known, maybe just have someone go up and wipe
So
things
it
down
kind of
with
looks
the
funny, when
lobby.
they've been, when a patient's been sitting in that lobby or in the bathroom or everywhere, and all of a sudden we're gowning up, I mean, I can imagine what every other patient's thinking, going, well, this, I just was sitting by this
And the
patient.
gowning should be done just outside their door. It's just, you know, once you bring them back, you don't
Yeah.
need to make a scene, you know, coming out in like a hooded moon suit, you know.
Well,
like
I
from the
know,
bar,
but I
or
mean-
something, you know, but you wanna gown before, right at the door.
If I'm
going
doing
in
an
and
active
out
MRSA
the door.
patient, yeah, I'm gonna glove and I'm gonna gown, you know, protect for precautions and all, but if the wound's covered, you know what I mean, when it comes to MRSA, the wound is covered.
Yes,
And
and
they're
there's
not
some
using-
clinical
and they're
judgment
not
that you're gonna
using
use to decide what you're gonna
Any
put
precautions when
on.
that patient's out in the community.
Oh, yeah, and that's fine, you would just put those things on with the exposure.
Okay.
Yeah,
Okay.
just inappropriate, and if it's, you know, MRSA in the NARES versus
Yeah,
MRSA in the
active
mood are
versus
two different
wound,
things,
yeah.
yeah, and active or not, yeah.
Totally.
So like she's saying, you just use your best judgment and, yeah, do your best. Okay, so the next one's droplet precautions. So what's the difference between droplet and airborne? So droplet precautions are for anything that's 5 microns or bigger. Well, what the heck does that mean? So these are kind of bigger droplets that when they cough, it goes in the air, but it's heavy. They're bigger and they kind of fall. They don't travel far. They're easier to contain. A surgical mask can catch that stuff. And so that's examples of that.
This is
Are
a mask for-
pertussis. Yeah, this mask is just fine for that. Pertussis, influenza, meningitis, pneumonia, parvovirus, which is Fifth's disease. We see that in kids a lot. Mumps, rubella, and rhinovirus, which is like typical cold viruses. So that's droplet precautions, gown, gloves, surgical mask, hand hygiene. You don't necessarily need your gown, I think, on droplet precautions when most of these. They have gown on here because some of those are contact as well as droplet. So they've got it in there just to be safe. So next are the airborne, and this is the blue, the big blue one that you'll see.
Can I just make, so,
Yeah.
sorry, because I do think this one, especially with the kiddos and stuff, like if they're really like, you know, coughing or, you know, you should probably try to protect your clothes, and especially if you hold multiple kids, like you know, then your clothes are infected, so
Well,
I
the
think.
kiddos should have a mask on too, though.
Yeah, but you know, little ones, like if they could
They already
potentially,
can't breathe, they have
Mhm.
fever.
Right. Right. So it doesn't hurt to like throw a gown on just to protect, so you're not getting all that stuff on you and one, passing it to other patients or to your family, so.
And I would say on any of these, it's always better to just err on the side of too much protection versus not. You know, and even if you're like, I'm immune, I have a good immune system, I'm not worried about getting sick, you see so many people during the day. It's just so easy to pass that on to someone else. And like Beth was saying, several of these have such a long incubation time. You'll never know you passed it on to them. They'll never know where they got it. You know, they may never know. But we can definitely help keep things at bay in our community by having really good PPE, yeah. Okay, so the airborne, this is where we need the N95 masks that we all just did the fitting for. So these are really tiny, tiny particles that will spread just by talking or breathing in the same space as someone. You can just breathe in the air they breathe, and those little pathogens are small enough to cause an infection that way. So examples, tuberculosis, measles, chickenpox, and disseminated herpes zoster. Well, what the heck is disseminated herpes zoster? Herpes zoster is the virus that causes chickenpox and shingles. So disseminated, meaning, so shingles they kind of come in zones, like dermatomes. And once that reaches 3 zones or more, it's considered disseminated or lots. So it's just kind of shingles out of control is what disseminated. So that, you always need your hand hygiene and your mask. So I made this little book. I'll get some tabs. We're out of tabs in that. So this is an example. Here's some contact section. These are examples of contact things. If you're like, well, I don't know what rubella looks like versus parvovirus rash. I don't know. You know, so you're the nurse, you're the MA back there. They brought a patient to you. This is kind of good just to be a little familiar. These are the most common ones anyway that you might see that the CDC recommends, being familiar with at least, so you might be able to recognize it when they came in. So this is what scabies looks like. So all of these pages have what is it, just a brief thing of what it is, how it's transmitted, and then what the symptoms are with it. And then up in the corner is gonna have the color of whatever precaution it is. So this is orange, that's the contact precaution. Then you can go to the cheat sheet and see, okay, what do I need for that? Okay, gloves, gown, hand hygiene, okay. So wound infections, VRE varies depending on where it is. Same thing with MRSA, depends on kind of where it is in their body, what it's infected. So these are examples of droplet precautions, pertussis and whooping cough. This is the difference between influenza and the cold. They're really similar things, a little cheat sheet on that. Pneumonia, not too much to show, but it gives you a little more familiarity with it. This is what parvovirus looks like. It's a rash really different from the other rashes. It's kind of like a lacy rash that shows up, so it's really good to, you can recognize this one pretty easily if you've seen the pictures of it, and then they have those really flushed cheeks. Mumps, it's kind of a funky one if you've never seen that before, but that's something that would come to the clinic too. If someone's like, oh, I just have a sore throat and I'm kind of swelling up on one side, it's gonna be that. It's not, yes, exactly. Yeah. This is rubella or German measles. This is different from regular measles, so it's a separate vaccination. They're together. And then airborne. So tuberculosis, again, nothing you're gonna see, but be really suspicious of coughing or coughing up blood in particular. So this is measles. I tried to put a lot of pictures on there for that symptoms. They get those watery eyes, in addition to their cold-like symptoms. They just look awful. But this is what the sores in the mouth look like early on. And what it looks like in the back of the throat when they come on. And they'll turn a little white after this. But these are kind of the preliminary things that probably you would see. This is the stage that you might see them in. And then the widespread rash. So a couple little facts about here, like things you want to pay attention to. It can live for 2 hours just in the air around you, if we do get that. Okay, and then chicken pox. Isn't that kid adorable? So cute. I love this kid. But so chickenpox is an example of an airborne, also with the contact precautions. And same thing with the disseminated herpes zoster. Regular shingles you don't have to do all this with. It's just when it gets to this disseminated stage they want to use on all of this. So little cheat sheet there. I can make one of these for the clinic if you guys want one over there. So now, Beth, we're going to show you how to do it.
Yep. So I know the surgical clinic has a isolation cart or a bin that you guys have on the wall. We're gonna create one of those for EMC, as well as we talked about making a little, like a mobile cart. And if you identify a patient that needs to be in isolation, you can go get this little cart and you're gonna park it outside of their door. It's gonna have all of these supplies in it. And you should put on all your appropriate PPE before you go into the room. So there's a sequence that they recommend putting all of this stuff on. Now that I say that, I'm probably gonna forget the proper sequence, but. So, I think, did you happen to bring the competency with you, the checklist?
Oh, I did not.
Okay, so the first thing you should do, make sure you have all your stuff. And the thing that we're gonna make is we're gonna put some red biohazard bags, so when you're done, you can throw all your stuff in the biohazard bag.
We have them in the bottom of all of our drawer, in the bottom drawer in every single room.
Oh, okay, good. All right, so you're gonna create like your little space to don and doff your PPE. So start by washing your hands, right? Always, if in doubt, wash your hands. And then
Are we gonna be able to get different size gowns instead of just extra large ones?
I think these are
Yes,
all.
They're just all one size.
Oh.
So, yeah, so I asked materials and they said it was just extra large so that it can accommodate everybody, yeah.
Okay, so gown, this, oh, I put my arm through the head hole here, that's not good. Okay, so these go on over your head, and then they have little thumb holes like this. You should tie these in the back, just so you're not, if you tie them in the front and then you touch something gross and then you untie them, they're gonna fall behind you and contaminate the back of your clothes. So tie them in the back. If you're going into an airborne room, I think the mask goes on next. So, like this. These all have little metal pieces in the nose, make sure it's, you know, nice and snug. If you're anticipating getting splashed in the face, I would recommend some eye protection, and then Ashley also liked these masks. These are like OR masks, but we thought about having some over there for you too. They have a,
We have some of those at the clinic.
you do? Okay,
They
so
were
it's
in our
mask
closet.
and eye protection in one happy package here. This
For
is-
anyone that wears glasses, those are a little bit easier than the
Goggles.
goggles going over your glasses.
Yeah. They just have 2 ties in the back. And then the last thing I'm gonna put on is my gloves. I'm gonna steal your gloves. Oh, thank you. So these little thumb holes are nice when you put your gloves on, just so your cuff of your gloves is gonna cover your wrist. How do I look? Look ready? Okay. So I can go in the room, do my patient care, talk to the family, whatever I'm gonna do. Now what do I do when I'm all done and I need to exit the room?
Rip your thing off, rip your gown off.
Right. So in the perfect world, we'd have a nice little ante room you could go out into and take off all your stuff, wash your hands and leave. But your exam rooms at EMC are pretty small, so just do the best you can. I would put the biohazard bag like in the corner of the room. And when you're ready to leave, there's 2 different ways that they say you can take off your PPE. The one I usually do is like a kind of a combo move where you rip this off and you ball it all up and your gloves come off at the same time. The other option is to take your gloves off first, since that's considered the most dirty part of you right now. But whatever you're comfortable with.
But if you're taking your gloves off first and then taking your gown off, you're contaminating your
Right.
hands.
I prefer to kind of do this move. So these are all breakaway. The neck will rip out. And then just kind of think about making this into a little ball.
And you put, she's putting one thumb to do the glove part, you put one
Underneath.
wrapped inside a thumb that wraps out one, and then, so you're on the inside, you know, clean hand going in the clean part again.
So then I would throw that in my biohazard bag, and then I would do all of this. And then go wash my hands.
Before
And,
you leave the room.
yes.
And it's always a good idea when you're taking your mask off to lean forward as you're taking it off, so you're not like dropping it back onto your clothes. So leaning over, discarding of mask, and then
Yes.
So where are as far as the question she just asked about where you wash your hands, where are the sinks in the room?
That's why it's
Right
kind
Unless
of
behind
they're,
the door.
unless they're right by
Yeah.
the door, if they're right by the door,
And-
okay, but you don't wanna, you know, be at the door taking off your stuff, that's the most ideal, if you have it right by the door, that's your transition spot, but if you're walking then to, across the room to get to a sink, that
Yeah.
So
isn't the best thing.
I think what we spoke about is if we had the isolation carts, putting a pump hand sanitizer on
Oh,
there so
that
that
would be
right
good.
outside the room you could just like pump and then sanitize your hands so that you're not
Perfect.
cross-contaminating. And then hopefully one day we can move to like outside the door pumps. So that would be great.
We've already talked about, asked them about that.
We asked
Yeah.
them when they did the remodel.
At surgical clinic, do you have hand sanitizer on the wall outside the doors? Okay.
You guys are so fancy. Not far in.
Okay.
Alright, you guys wanna try it?
All right.
Alright, so everybody,
Backwoods and paraphernalia.
Okay.
Saying don't